Hello everyone, this is Casey from the therapy department here at Edgewater. We hope that everyone is staying safe and healthy. September is Fall Prevention Month, so today I'm here to give you a presentation actually created in conjunction with the Occupational and Physical Therapy Accrediting Association. And today we're just going to talk about ways that you can prevent falls on a daily basis and how falls are not a normal sign of aging. So the first major question is, are falls preventable? Many of us want to know, are falls preventable? The simple words, she fell, have a huge impact on us. We all know someone who has had a fall and experienced significant life changes. But are falls truly preventable? The answer is yes. The good news is yes, falls are largely preventable with simple measures. This presentation is going to teach you how. Falls are experienced by many older adults, a common experiencing managing fall risk as a normal part of aging. However, this is not true. Okay, in today's discussion, we are going to talk about what a fall and fear of falling are and the impact they have on us. We will also talk about what makes an older person more at risk for falls, and we will talk about action steps you can take to reduce your risk of falling. So what is fall classified as? Landing on the ground or some lower surface when you didn't intend to is a fall. This includes slips and trips. Accidents that cause you to fall, like getting run into by a scooter or shopping cart, are not considered falls, since they are not your fault. You do not have to land on the ground to have fallen. For example, if you stand up from a chair and lose your balance and fall back into the chair, that is considered a fall. So, have you had a fall in the past year? Were you hurt? Do you worry about falling on a daily, weekly, or monthly basis? Do you feel unsteady when you walk or when you stand? A previous fall also indicates that you are at risk for future falls. When asked, are you afraid of falling? Many people will say, no, I am not afraid. I'm just more careful. A fear of falling is defined as a lasting concern about falling that may cause a person to stop doing activities that he or she remains able to do or enjoys. For instance, if a person stays in most of the winter because of concerns about slipping on ice, then the ice and fear of falling is limiting their activities and social interaction. This fear of falling in itself is a risk for falls. So why does fear of falling matter to us? Well, it can stop a person from doing some of their favorite activities that are more important to their mental and physical health. Legs weaken with inactivity. When we sit, we lose the muscles that we need to use to stand and walk and move properly. Inactivity leads to falls due to the change in muscle strength, balance, and coordination. It may make the person feel alone if they cut out the activities that are socially active, which can result in depression or anxiety. Types of fall risk factors. There are 3 main types of risk factors, and we will talk about them individually. Most falls experienced by older adults result from the interaction of a number of risk factors. We don't all have all risk factors. We each have our own set of risks. The physical risk factors are changes in your body that increase your risk for a fall. For instance, if you are inactive and you sit for long parts of the day, your legs become weak. Behavioral risk factors are things we do or don't do that increase our risk of falls. This could be taking a greater risk, like climbing a ladder to remove leaves from the roof, or even reaching above into a cabinet that you may not quite reach that you need to be going on your tippy toes. This might not be a great idea. Environmental risk factors are hazards that are in our home or community. Porch steps without a railing, a toilet that is too low, or a tub without grab bars are examples of environmental risk factors. So some fall risk factors are listed here. We all have different types of risk factors, like said earlier. Some we can change and some we cannot. We are all challenged to improve the risk factors we can change. We can become physically active, have our home environment evaluated and fixed, get our annual vision checks, make sure our medications are reviewed and considered for fall prevention. We can deal with fear of falling through education, especially using evidence-based fall prevention programs that we will talk about later. We can increase our social activity, we can exercise and improve any weak muscles, and we can learn how to use assisted devices that are fit for us, and we can use them right away. What can you do to prevent falls? Falls are the main reason why older adults lose their independence. The CDC, or Centers of Disease Control and Prevention, has a great brochure they call Stay Independent. It focuses on 4 main things that you can do to prevent falls. Exercise to improve your balance and strength. Have your doctor or pharmacist review your medications. Have your vision checked yearly. Make your home safer. So as you can see, they show a little bit of a exercise program there up top, that it takes 50 hours every 6 months to improve your balance. So that's anywhere between 6 to 7 days a week, depending on how long you practice your balance exercises. And this is something that one of our physical therapists can help you do and train you in on exercises that would benefit your balance. So these are the exercise recommendations that are very generalized. We will, first of all, you start by talking to your doctor or healthcare practitioner before starting an exercise program to make sure it's safe for you. Begin with PT or physical therapy to be sure that the classes and exercises you are doing are appropriate for you. Be sure that the classes you sign up for are designed for your age group and ability level. We do have access to Mike's exercise classes, both now in person and on the Channel 95 throughout the week, that can also help with some of your balance activities and strength. If you find something that works with you, you want to stick with it. So we typically don't see change in our balance or strength overnight. So it is very, very important to continue strength training over a series of months in order to really see the changes in your body, including your balance and strength. So environmental recommendations. An important thing that each of you can do to reduce your risk for falls is to identify and eliminate fall hazards in your home. To start the process yourself, a helpful brochure from another one from the CDC is Check for Safety. These we can provide to you guys if you would like to reach out to the therapy department. We can print out these brochures for you and give them to you. There are a lot of hazard checklists available, and they generally guide you through your home room, by your room, through your bedroom, your kitchen, your living room, etc. It lists common hazards that can be identified in these rooms. Like the CDC brochure, it makes recommendations to fix that hazard. For instance, it will ask you, do you have throw rugs on the floor? It's typically recommended that you discard of these rugs or use double-sided tape in order so that the rugs cannot come up and create a tripping hazard. An occupational therapist can also help you identify safety issues in your home and provide individualized solutions based on your abilities and your needs. An occupational therapist, or OT, is trained to look at safety dangers or things inside and outside of your home that can cause you to fall, and then give you suggestions to prevent falls. Medications can cause a fall risk. Some medication side effects may make you dizzy, unsteady, or sleepy. Speak with your doctor or practitioner to see if alternative medication is available without these side effects. Use one pharmacy so that the pharmacist can be aware of medication interactions, especially if you are taking more than 3 medications. Ask your pharmacist or physician to review your medications annually and anytime there is a change to your prescriptions or over-the-counter medications. Be sure you can read prescription labels. That way we are not taking double or too few of our daily medications. It is very important to have at least one eye exam every year. If you have visual problems from diabetes, glaucoma, macular degeneration, or other eye problems, you may need to see your eye doctor more than once a year. Your fall risk may decrease if you follow your eye doctor's recommendation to have cataract surgery, particularly if you are a woman. However, be careful. Falls can increase after cataract surgery due to the change in vision. Be very cautious as you adjust. When you are first starting to wear bifocals, trifocals, or progressive lenses, it can take you some time to adjust how they hold your head and how you can see clearly through them. This is particularly true when going up and down steps or curbs. You may want to hold on to someone's arm or use the handrail every time you go up or down the stairs. If there isn't a handrail or someone to hold on to, look around to see if there is a ramp you can use or go another way around than using the stairs. Or consider single-use lens. So this is very important. So when you go out in the community, say to the grocery store or a pharmacy store, that you always want to be aware of your surroundings to see if there's any changes, say from concrete to carpet or a step up into the main entrance, that you are aware so that you can decrease your risk for falling. Has your blood pressure been checked regularly? Speak with your doctor about how often to check your blood pressure. If you get dizzy when you stand up after sitting, see your doctor and have your blood pressure checked for postural hypotension. Some blood pressure medications increase fall risk. Many blood pressure and cardiac medications will initially cause you some dizziness as you change positions. For the first 2 to 3 weeks after starting a new medication, be especially careful to get up slowly and count to 3 before standing up and walking away from where you were seated. Chronic conditions and fall risk. All chronic conditions can impact fall risk in many ways. Diabetes might change the sensation in your feet. Arthritis can cause pain that may make you walk abnormally. Stroke may cause weakness in one side of your body. MS, Parkinson's disease, and other neurological disorders may affect balance and mobility and increase fall risk. Your changes and chances of falling may increase when you change your medications, if you become sick or have an infection, or if your pain level changes. It can also increase if you are tired or having ongoing sleeping problems, or if you are sad, worried, depressed, or anxious. If you have any reduced activity level or bed rest, your legs may become weak and increase your fall risk. Fear of falling also contributes to the cycle of inactivity, weakness, and increased fall risk. With the new use of a cane or walker, there is an increased risk for falls. Be sure you give yourself plenty of time to learn how the new device works. This is something that our physical or occupational therapist can help you set up. So if you get a new walker or cane, or you think that you may benefit from one of those, you can give us a call in the therapy department and we can fit you appropriately for a cane or walker to help with your mobility. So you want to start small. There are many things you can do to prevent falls, but you want to start small. Choose one risk factor to address and contact a health professional who can help you address it. Your pharmacist or doctor can review your medications to look at the side effects that may cause you to fall. There may be alternated medications that will work for you. An occupational therapist can do a home assessment and give you ideas to make your home safer to help you decrease your risk for falling in the home. A physical therapist can teach you how to use your cane or walker at the appropriate height and help with balance, strength, and your ability to walk safely. What should you do if a fall occurs? Check for injury. Call for help if needed. If you think that you hit your head or you know you hit your head, you want to seek medical attention right away. This is very important if you're taking a blood thinner medication, since it may cause you to bleed in your head. You want to call your doctor, check for any safety hazards around the room, and learn how to get up safely from a fallen posture through physical therapy. Evidence-based means that there is research that shows that the program is effective in preventing falls. The CDC has identified a number of evidence-based fall prevention programs that are intended to decrease falls and injuries from falls. Today we are going to discuss some of these programs. So the Otago Exercise Program, or OEP, is an evidence-based exercise program. This particular program is done one-to-one by a trained PT or OT and is delivered in a part of a complete physical therapy or PT program. This program will be paid for by Medicare and other insurances when needed as a benefit and when needed to reduce your risk for falls. It includes exercise and a community walking program that are designed for you from a menu of exercises that your PT chooses based on your particular needs. If you or your physician feel you should begin with PT, make sure your PT includes the OEP or is familiar with this program. If you ever need to have a PT or physical therapy order, you can always ask your doctor or nurse practitioner in order to write that order for you. Matter of Balance is a community-based group class that includes 8 weekly 2-hour sessions, including peer discussions, gentle exercise, education, and some behavior modification. It is particularly aimed for people who have significant fear of falling. All the exercises can be done in sitting or supported standing, and therefore do not require the same level of mobility as some of the other programs. It is a great starting program. This link below is for more information regarding the Matter of Balance program, and if you have any questions, you can reach out to our therapy department. The Stepping On program is also a community-based group class that is 7 weekly 2-hour classes, including peer discussion, exercise, and weekly expert lectures. Stepping On classes include standing exercises that are done by a chair independently that may tax your balance and strength. This is a good progressive program. Tai Chi, which we do offer here, is a fantastic program for ongoing fitness and balance training after you have completed one of the previous programs or completed a physical therapy program. It does not include an educational component, nor is it limited in length or times of day. Classes are usually ongoing and not limited to a certain amount of weeks. Participants should be able to stand on one leg for more than 5 seconds, not having a tremendous fear of falling, and have an active lifestyle. Tai Chi has been shown to have remarkable benefits, including decreased fall risk, stress, improvements in existing medical conditions, and mental health. So these are just a slide with some of the evidence-based programs that we discussed. Again, if you have any questions about any of the programs, you can always reach out to us in the therapy department and we can discuss them further with you. So the most important thing is that you want to remember to move. The bottom line is that if you move more, your body will be stronger and fitter and have a decreased risk for fall. Find something you enjoy and go for it and stick with it. The other thing we'd like to add is that for any of our residents who have neurological disorders, progressive neurological disorders, or Parkinson's disease, we also do have trained therapists in the LSVT BIG program, which is a balance and walking program that is specifically designed for those of Parkinson's disease. And so if you or a loved one have any questions about that program, it is good for all levels of Parkinson, and you're more than welcome to reach out to the therapy department and we can give you some more education regarding that program. Again, balance and fall risk prevention are certain therapies and certain things that are covered by Medicare. So if you have any questions about falling, if your home is appropriately set up for you, if you have had a fall in the last year, or feel like you are off balance with walking, standing, or through your daily activities, give us a call in the therapy department here at Edgewater, and one of our therapists are more than happy to speak with you and see if you would be a good candidate for physical or occupational therapy. Again, we hope you guys are all staying safe, and if you have any questions, please don't hesitate to reach out to us. Thank you.